Please join me in welcoming the Eastern Virginia Medical School class of 2027. Thank you. While I still have the students standing, please turn around and thank your family and significant others who have given you the opportunity to be successful and here today. Students and faculty, you may be seated. Welcome to the EVMS MD class of 2027 White Coat Ceremony. At this time, I would like to acknowledge our board member who have joined us here today. Hans, please stand. I also want to welcome our students and their families and friends who have joined us today. I know you've been waiting a long time for this, and I see many proud and excited faces. Academic health centers typically have 3 special days of commemoration in the course of an academic year: commencement, match day, and white coat ceremony. Commencement is a day of formal and regal tradition, a celebration and acknowledgement of the accomplishments of our graduates. Match day, when you will learn where you will be attending residency, is an exciting and festive event full of suspense and anticipation. Then there is the white coat ceremony. Of these 3 days, today is my favorite. The white coat ceremony affirms the core values we hold dearly in medicine: professionalism, integrity, compassion, empathy, and dedication. This ceremony reinforces the reasons all physicians and I answered our professional calling: to care for those less fortunate, to comfort the sick, and to make a difference in the lives of those we serve. It's a great privilege and joy to be a physician. To the class of 2027, more than 7,100 people applied to be in your seats, but only 151 of the best and brightest joined your class. Half of you are from out of state and half from Virginia, including 33 from right here in Hampton Roads. Collectively and individually, that deserves an applause. Thank you. You are among the best of the very best. The class average GPA is 3.67 with an average MCAT of 512. These credentials only reflect, however, your past academic accomplishments. You sit here today to answer an important calling: to become the best possible physician for your patients. You see, it's no longer about you, it's about your patients. Medicine is a demanding, challenging, joyful, and rewarding profession. It's an absolute privilege to care for those less fortunate and to improve the lives of the patients and families we serve. There is no more satisfying professional experience than healing and comforting those under your care. You will change the world, one patient, one family, one community, and one nation at a time. Today, we celebrate your entry into the profession of medicine, and you assume the obligations of being a physician and a member of our wonderful profession of medicine. The study of medicine is intellectually challenging and can be difficult at times. Occasionally, you may even find it a bit overwhelming. Let me reassure you, on times you are going to find this overwhelming. But with perseverance and mentorship of our outstanding faculty, you will succeed. When you don your white coat today, wear it with the reverence of the medical profession itself. Wear it with a commitment to excellence, humility, compassion, altruism, empathy, and selflessness, recognizing that it's an absolute privilege to be a physician. On behalf of our EVMS faculty, I welcome you to our passion and to our calling, the wonderful profession of medicine. Now it is my pleasure to introduce Elizabeth Lindsay, MD Class of 2024, to tell you about the heritage of this ceremony and the symbolism of the white coats.
Good afternoon. My name is Elizabeth Lindsay, and I am a fourth-year medical student here at EVMS. I would like to start off by saying to the MD class of 2027, congratulations. It is an exciting time to be going into medicine, and we are truly elated to have you here. Today, your family, friends, colleagues, and mentors have gathered to welcome the future of EVMS into the profession of medicine. At EVMS, this welcome involves donning the symbolic white coat. As a member of the Gold Humanism Honor Society chapter at EVMS, I am honored to tell you about this ceremony, this symbol, and its significance to you. The white coat ceremony has a treasured history. It was founded by the Arnold P. Gold Foundation at commencement for Columbia University's College of Physicians and Surgeons in 1993. Where the late Dr. Arnold Gold was a professor and pediatric neurologist for more than 50 years. Dr. Gold's wife, Dr. Sandra Gold, witnessed students delivering the Hippocratic Oath at Columbia's graduation and concluded that the Hippocratic Oath was being recited 4 years too late. Instead, she and her husband decided to formally induct medical students into the profession at the beginning of their studies and subsequently developed the white coat ceremony. The Gold Foundation celebrates humanism in medicine and introduces medical students to their roles and responsibilities in the medical profession on the first day of their education. Today, white coat ceremonies occur at 97% of accredited schools of medicine in the United States, Canada, and in 13 other countries. Your white coat symbolizes your entry into the medical profession and welcomes you as a junior colleague. The white coat is personally placed on each student's shoulders by individuals who believe in your ability to carry on the noble tradition of doctoring. It is a personally delivered gift of faith, confidence, and compassion. More importantly, the white coat is a covenant between you and your future patients. By accepting this white coat, you are accepting the responsibility to develop, maintain, and improve your skills and knowledge for years to come, while also maintaining professional attitudes and behaviors becoming of a student of your caliber. Wear your white coat with a commitment to excellence, humility, compassion, altruism, empathy, and selflessness. As you all have been on this incredible but difficult journey to medical school, I'd like to leave you with a few thoughts today. Be kind. As many of you have already noticed, we have an amazing culture at EVMS where students are cooperative, good-natured, and supportive of each other's successes. Getting to know my friends and future colleagues has arguably been one of the best parts of medical school, and if you are able to successfully cultivate this collegial environment, your classmates will become your family away from home. I urge you to carry on this tradition as it will become important for your well-being as you devote yourself to studying and learning. Be humble. EVMS graduates are known for their legacy of being extremely humble yet hard-working physicians. We cultivate the idea and culture that medical education is a privilege. We are incredibly fortunate to be here, and the faculty, the administration, the hospital staff, and our patients all play an integral role in our education. Be present. Whether during an anatomy lecture, a clinical skills session, or caring for a patient, be fully invested in where you are. Practice the art of listening and be patient with yourself and others throughout this journey. Some of the most powerful moments of my medical school experience were where I took time to pause and be present with a patient, a classmate, or in self-reflection. When you fully engage yourself in each experience, you will find many opportunities to learn and grow as a person and as a future physician. Be community-centered. As many of you know, this school was a result of a grassroots movement in which the local community came together to build a medical school to meet the medical needs of Hampton Roads. Whether your goal is to become a primary care physician, radiologist, surgeon, or anything in between, at the foundation of the medical profession is the desire to help those in need and cure the sick. Further, a firm foundation and belief in the why of medicine will carry you through the darkest days of medical school, when schoolwork seems overwhelming and patient care seems exhausting. The opportunity to interact with the most marginalized of our patients has been vital in reminding myself why I wanted to be a physician in the first place. Lastly, be excited. Getting to this point is no small task. You've taken your first steps toward officially becoming a physician, and you will make many memories in the coming years. While medical school is challenging, it can be one of the most rewarding experiences of our lives. Be excited to learn, experience, and grow. On behalf of the MD class of 2024, congratulations to you on this special day. We're incredibly proud to call you our colleagues. As your white coat is placed on your shoulders for the first time, take a moment to look around. You are all together in this journey. Congratulations again, and we're happy to have you join the EVMS family. And now, please join me in welcoming to the podium Dr. Ronald Flenner. Dr. Flenner is the Vice Dean of Academic Affairs and a graduate of the MD class of 1989.
Thank you, Elizabeth, and good afternoon. To the class of 2027, I want to say congratulations. Today marks a very special day in your medical school journey, and now you will begin the work you came to EVMS so eager to do, to learn from the faculty, staff, from each other, and very importantly, from your patients. You've heard repeatedly that the road ahead is challenging, but I'm here to tell you it's very worthwhile as well. You are going to be the next generation of physicians, and there are countless people in the community, in our country, and the world who, in fact, will depend on you to improve their health as well as the health of their communities. Let the white coat serve as a constant reminder of that responsibility. And never underestimate the impact you can have on a person through your work, and never forget the importance of loving what you do. In truth, nothing you do as physicians will be more important than to know and care for your patients. And in terms of personal satisfaction, there is none greater than being able to help another human being. And I know in the experiences you will have here at EVMS, it will shape the rest of your lives, and it's my pleasure to be even just a small part of that journey. It's also an honor today for me to introduce our keynote speaker, Dr. Rolando De Leon. Dr. De Leon knows all too well what lies ahead for you. He once was in your seat as an EVMS graduate of the MD class of 1982. What he learned here and in his residency training in obstetrics and gynecology has served him well. He has spent the past 35 years in Miami delivering babies, and in fact his career recently came full circle as the first baby he delivered came back to him as a patient for delivery of her own child. This is one of the last babies he delivered before beginning his own new chapter as the chair of obstetrics and gynecology at Nova Southeastern University. His future students are fortunate to have him, as we are to have him today for the keynote address. So please join me in welcoming Dr. De Leon.
Thank you. And good afternoon. There's a bet in Miami, and over-under of all my colleagues wondering, I lost the bet, wondering how long it would take me to get emotional here. And they all bet 90 seconds, and they lost. Thank you, Dr. Flenner, President Abu Hamad, for this very undeserved introduction and this invitation. Guys, first important take-home point, okay? As residents and attendings, remember to be very nice to your junior residents, interns, and medical students. Because you never know who's going to become president of your medical school one day. You know, if I hadn't been that nice to them, I can assure you I wouldn't have been here. So let me congratulate you on the amazing feat that you've accomplished. As Dr. Muhammad said, you know, it's an amazing feat. It takes a village. Your family got you here. As medical school faculty, I want to preemptively thank the people who are going to get you through this. These folks right here, okay? This is no doubt well-deserved. If my story, which really isn't a speech, has a title, it should be The Gift. And there's no doubt that you being here is very well-deserved, you guys. I know that. You wrestled with organic, biochemistry, trying to make sense of magnetism and electricity and physics too, right? Spoiler alert, you're not going to use it again. Okay. You know, to get where you are, you practically had to discover a new element in the periodic table, right? You had to go to the four corners of the world to do research, deworming orphans, all the while trying to stay healthy enough to take that quiz that we all had to do. What was that called? An MCAT, right? You know, and despite all that, you made it. But make no mistake, your being here is a beautiful gift that you were given. Not only was it a gift to be admitted to medical school, this is not going to be recorded and make its way to South Florida, right? Okay. Not only did you make it into medical school, but you made it into the best medical school in the country, right? Come on. Really? I know, because I was there. We share this gift. We share this gift. So today, I want to share with you via story when I realized the significance of this gift and how it changed the purpose of my life. So, unlike you, I was not a stellar student, not even close, okay? But despite below average grades and a semi-decent MCAT maybe, this new medical school in Norfolk granted me an interview. I came, I was waitlisted, I was deferred, and walking away, they called me and said, would you consider applying next year, early decision? I said, of course. I loved my interview there. I didn't share it was my only interview, but I said I loved it, right? So I applied, and early decision, September 30th, 1978, my gift arrived in the form of an acceptance letter. We got letters, you get emails. I'm sorry, letters are far more dramatic, okay? But I was 21 years old. I was too young and ignorant to really recognize what the gift was. But soon I realized that those 3 years were pivotal in my life. And I began to see that the gift was not merely about being accepted to medical school, but was about immersing myself with 93 other amazing individuals. Where we were dumped into the world of medicine. We were led by a dean who was simply referred to as Pooh. We had faculty who actually thought of us as younger peers, and we made this all possible because we carried each other. And this is part of the mentality that I want you to share, because what we had was a no one left behind mentality. And that's what I want you to embrace. And I want you to stop for a minute and just look around to your peers. Take a second and really look around at these people. These are going to be your brothers and sisters for life. Look at your faculty, okay? Yeah, even my friend here at the end, right? Even my friend at the end. These are all part of your gift. They are all part of the gift that you have been given. So, 3 years in Shangri-La, 7 years in the abyss, okay? I did my residency at the University of Miami Jackson Memorial Hospital in the 80s. I am going to leave it to President Abu Hamad at some point to share memories of what medicine in the 80s in Miami, cocaine cowboys, etc., was all about. Do not share the stories from last night. Okay. Okay. So fast forward a few years, and this is where the story starts. If the music cues up, I'll shut up. I'm imagining this is somewhat like the Oscars, that when my time runs out, the music is going to start. But anyway, a good friend of mine who was a resident at Jackson had gone to work as a medical missionary in a remote village of the northern part of the Dominican Republic. We couldn't have audio-visual, so I sent you guys PowerPoints on purpose, because I really think that a picture's worth 1,000 words, and I'd be talking all night, so I sent them to you so you can scroll through and get an idea of what this was all about. He'd been there for a while, and he was seeing all sorts of patients, and he realized that a lot of what he was seeing were surgical conditions, and that he needed a group of surgeons. So he came back to Miami, got a bunch of us, and convinced us to go down. He got 2 general surgeons, a couple of medicine residents, myself, some volunteers. We raided an OR's staff. We took nurse anesthetists, scrub techs, everybody, and we came back to the Dominican Republic. Now, at the end of the town was an abandoned hospital, which you'll see in one of the pictures, a very young Dr. De Leon standing in front of it. It was an abandoned hospital. There were beds, but no mattresses, sparse electricity, contaminated water, no medical equipment. So we brought everything. We set up a clinic and started seeing and triaging patients. Our plan was to do the most acute cases first until we ran out of anesthesia, IV fluid, gases, everything. So we'd begin surgery like at 7 a.m. in 2 operating rooms, one for major cases, one for minor cases, and we'd work well into the night, sleep for a few hours, and then begin again. The cases we saw, guys, were beyond the description that I can share with you. And they were far beyond what we felt our surgical skills and knowledge were. They were far beyond what we possessed at the time, yet we were able to do it. Ostomy breakdowns, I dealt with obstetrical, rectal, and vaginal fistulas. We even saw a 9-year-old boy whose arm was melted onto his chest from a gas fire, and were able to create flaps and release it. I even delivered a set of undiagnosed twins. Amazingly, in the middle of nowhere, everything progressed uneventfully. No transfusions, thank goodness, because we had no blood, right? No post-op complications, not even infections. Everything ran incredibly well. I don't remember how many cases we did. What I do remember is that despite my 7 years at one of the largest hospitals at the time in the United States, and the experiences that we shared there during that time, I felt like I had become twice the surgeon that I ever was. So, on the last day of our mission, we were done. Everything was packed up. We had a bus to take us on a 4-hour ride to the airport, or 4 or 5-hour ride. And right before we left, Dr. Moaz, my friend, myself, and my wife, Debbie, in the front seat with the yellow dress, were making last-minute rounds on the 20 or so patients who remained. When a woman walked in with one of the missionary nuns with a real skinny, scrawny 8-year-old kid. Well, this kid's peritonitis shuffle and the fact that he was holding his right lower quadrant meant he had what? Aren't they in medical school? What? Appendicitis, thank you. Excellent, excellent. So, the bus was full of people, right? So we took the boy, my wife, Dr. Morris and I, we laid him on the table. He was so skinny and had an anterior lying appendix, you could feel through the skin and almost feel it, okay? So at that point, we say to the mother, listen, this is what he has. We're happy to take him with us. We can take him to a hospital near the airport where he can have an appendectomy. Amazingly, she just picked up the boy, started walking away with him, and she was going to give him some home remedies and just take him home. So my wife asked, she says to the nun, well, what's going to happen? And the nun said, well, we see this every once in a while where kids show up and they have really bad stomach aches. They get really, really hot, and then they die. And it was part of life. When my wife heard this, remembering our twin boys in Miami, she says, not today. This isn't happening today. Not on my watch, this isn't happening. And she tells to Carlos and I, you have to take out his appendix. Now, the bus had already left, right? We're there, we're stranded. It's this friend of mine who's a pulmonologist, myself and my wife, and we're figuring out, we had no oxygen, we had no nitrous, we had a little bit of meds that we had left over, and that was it. So Dr. Moas said, I found a pediatric endotracheal tube. I think I can intubate him, we can paralyze him, and maybe you can do the surgery. And I'm like, remember, I'm a gynecologist. This is a male 9-year-old, right? The last time I saw this was 3rd year EVMS Portsmouth Naval Hospital, right? So it really came down to if we didn't operate, the boy would die. If we operated, he might die because we really did not have the equipment. So it was just the 3 of us and a couple of the nurses who were there. So we carried the boy to the operating room. We were in street clothes with just surgical gloves on. We took a deep breath and started. And Dr. Moas successfully intubated the kid. We paralyzed him, ventilating him with an ambu bag with room air, right? Still 20% oxygen, but room air, right? And he paralyzed him and started ventilating him. He gave him a little bit of succinylcholine. We paralyzed the boy. And I'm there I'm flashing back to 3rd year EVMS, remembering McBurney's point, right? And I'm like, I think it was, I had done appendectomies, but on women in the course of doing a hysterectomy. So I'm trying to remember where this is. And I followed the procedure to the best of my memory. I cut the skin, I separated, I cut the fascia, separated the muscle, picked up the peritoneum, cut it, and just like that, guys, out popped the appendix, right into my incision. I picked it up, clamped it twice, stitched the first stump, buried the second one, right? Closed the layers. I think the whole procedure maybe took 7 minutes. So I'm there holding the appendix, and I look at the head of the table, and I'm like, Carlos, I'm done. He goes, you're done? He goes, yeah, I'm done. Here's the appendix. I'm done. He goes, are you sure? Yeah, it's done. It's closed. There's nothing else to do. So he reversed the paralysis, right? Extubated the boy, reversed the paralysis, and we pretty much were holding our breath, waiting for him to breathe. Well, he started to cough almost immediately, and we were like, okay, when he breathed, we breathed. And we immediately moved him to the post-op area, and with no time to celebrate, because remember, an hour and a half had passed, the bus had left, we had to catch him. We're like, we need a ride to catch this bus. So what shows up to take us there is a little tiny Fiat. Think of a clown car from the circus, right? Now, one of the perks of being an XXL type, right, is that you always get shotgun, right? Oh, you go in the front. It's okay. Rollo, you can go in the front. So I get in the front seat, and we leave. And we leave dirt roads all the way, and about 15 minutes into the ride, I start crying uncontrollably, but sobbing uncontrollably. My wife is behind me. She's rubbing my shoulders, and she's saying, it's okay, Rollo, it's okay. You got the appendix. He's okay. He's going to live. And the more she would comfort me, the more I would go, no, that's not it. And she would say, he's okay. No, that's not it. I was not crying in cathartic relief for what we had just experienced. It was way deeper than that. All of a sudden, I flashed back to September 30th, 1978, when I received my undeserved letter of acceptance to EVMS. And at that moment, in that clown car, on that dirt road, I had my epiphany of what my gift had truly been all about. I was overcome with the realization that I had to have been accepted to medical school, study, finish, become a physician, complete a residency that provided me the surgical knowledge and training to be able to be there that day to save that boy's life. Everything had come full circle. The endless studying, the clinical rotations, the long nights on call had all led me back to that moment. I realized that the gift that this amazing institution had given to me needed to be put to the service of others for the rest of my life. I've never refused the care of a patient. For 30 years, I have dragged this poor woman to desolate places to accompany me to do mission work for the people. And 90% of that work wasn't really to change the course of healthcare wherever we were going. It was a drop in the bucket. It was really to remind the people in those villages that the world had not forgotten them. we still remembered they were there, and we were there to be for whatever little bit of time we could for them. Guys, I'm 66 years old. I'm about to retire from clinical practice, like Dr. Flunner said, to spend the rest of my time mentoring and teaching your generation of physicians. My wife says it's a very easy job, okay? She says, Rollo, your job is really easy. And I'm like, really? Let me talk to you about neuroembryology, right? And she said, no, your job is really easy. All you have to do is make them fall in love with medicine. Like you have, and it's going to take care of itself. And it's going to take care of itself. So you have been given this very gift, guys. This is your gift. We share this gift. It's ours. We're here. This is our gift. So as you put your white coats on today and you begin to assume the superhero identity that lives inside of each and every one of you, right? Remember, this white coat is an external sign of the gift that you have been given. It represents healing and hope. Just as sure as we're sitting here today, I'm telling you that right now, there are thousands upon thousands of people who don't even know you. They don't know you, but they are patiently waiting for you to finish medical school, become physicians, complete residencies, so that you can be the healers and lifesavers for them and their family. It's for them who we study. It's for them who we stay up late at night and wake up early and sacrifice weekends and everything that we're going to sacrifice. It's for them that we're going to learn to develop and sharpen our diagnostic and surgical skills. The cool part about this is we don't have to go to the ends of the world to find them. Because you know what? They're going to find us. They're going to find us. And they'll find you. You know why? Because those white coats are magnets that are going to call to them. They are magnet for those in pain, for those who are suffering, for those who need healing. All we have to do is recognize them and have the courage to say yes. Guys, share this gift. Share this gift every day of your professional lives, okay? Being with you here today at our EVMS has really been the greatest honor of my professional life. Thank you.
Thank you, Dr. De Leon, for your insightful words. And I wish you the best in your new job. It will be the most fun and rewarding position you've had, but I have not found it to be easy. It's now time for the presentation of the white coats. Would the chairs or their designees from our basic science and clinical departments please rise as I call your names in order of department. Representing dermatology is Department Chair Dr. Abby Van Voorhees. Representing emergency medicine is Department Vice Chair Dr. Michael Bono. Representing Family and Community Medicine is Department Vice Chair Dr. John Snellings. Representing Internal Medicine is Department Chair Dr. Rehan Khayyam. Representing Microbiology and Molecular Cell Biology is Department Chair Dr. Julie Carey. Representing Ophthalmology is Department Chair Dr. Shannon McCole. Representing Otolaryngology is Department Chair Dr. Barry Strasnick. Representing Pathology and Anatomy is Department Chair Dr. Richard Conran. Representing Pediatrics is Department Chair Dr. C.W. Gowan, Jr. Representing Physical Medicine and Rehabilitation is Department Chair Dr. Beverly Roberts Atwater. Representing Physiologic Sciences is Department Vice Chair Dr. Diane Duffy. Representing Psychiatry and Behavioral Sciences is Department Chair Dr. David Spiegel. Representing Radiology is Department Chair Dr. Lester Johnson. Representing Surgery is Department Chair Dr. L.D. Britt. The chairs and department representatives are here today to help students into their white coats. We have a tradition here at EVMS of allowing legacy family members or EVMS-affiliated physicians to assist in donning their students' white coats. And today we have 7 families who meet the criteria. These students will be presented their coats at the end of the group. When your name is called, please approach the stage. And at this time, I would like to invite Dr. Abu Hamid and Dr. De Leon to join me so we can congratulate each student as you leave the stage.
Adiola Abdul Qadir. Shoba Abraham. Gabriella Adams. Parker Adams. Shazia Ahmed. Richard Albright. Claire Allison. Miranda Andrews. Arusha Arif. Chase Armstrong. Andrew Bahuth. Shannon Becker. Ellie Bettingham. Carter Berry.
You may now don your white coats.
Joshua Betancourt. Tarun Badri. Saad Bhatti. Megan Bianchetta. Zachary Bowker. Andrew Bowie. Yi Bowie. Emily Burnett. Andrew Califano. Hannah Call. Pew Chaw. June Choi. Turner Clark. John Cochran.
You may now don your white coats.
Daniel Connolly, Thomas Cook, Hayden Cottle, Anthu Kung, Spencer Davis, Leslie Dillon, Christopher Dorney, Alexander Dornstouter, Rebecca Duncan, Eric Earl, Danae Easley, Amira Azeria, Julia Fjord, Tyler Furkeron.
You may now don your white coats.
Chris Finocchio III, Robert Fisher, Zachary Goodrich, Danielle Gore, Nivedita Goswami, Kasun Ganawardana, Brittany Harris, Eric Harris, Eric Hayes, Alexis Hernandez, Simone Heron, Karen Ho, Braden Hodges, Jacob Hoffman.
You may now don your white coats.
Andrea Huberman Pinero, Jingru Huang, Emilio Eide, Matthew Jackson, Lily Kaufman, Alden Kaufman, Mehran Kuistani, Amir Latifian, Zachary Lawrence, Rebecca Lee, William Lee, Ang Lee, Janae Lillard, Andrus Jackson,
You may now don your white coats.
Alex Liu, Remy Lloyd, Brian Luong, Avery Letter, Tyler Lin, Bhavana Madhu. Jacob Maniot. Bailey Marin. Kyle McKee. Samantha Meacham. Sawyer Miller. Kevin Moran. Emily Mungovan. Dewik Manjwani.
You may now don your white coats.
Purva Nayam. Sydney Odell. David Park. Irene Park. Sarah Park. Corinne Parker. Victoria Parton. Himali Patel. Urvi Patel. Inaya Pendleton. Madeline Peterson. Gregory Pierpoint. Alexa Ralios. Kailash Ram.
You may now don your white coats.
Gautam Ramanathan. Maya Rao. Mary Reed. William Rice. Sarah Rizvi. Raymond Roberts. Kai Rosbach. Isabel Russell. Pavan Sage. Ravjot Sani. Nasser Selim. Benjamin Samberg. Kaylin Torres Samaranos. Elena Sargent.
You may now don your white coats.
Maren Schroeder. Avery Seward. Zachary Shalley. Rachel Shaughnessy. Emily Sheets. Anisha Sheth. Joshua Shields. Dogmawi Shimalis. Sonali Shirali, Colette Sholi, Sejal Sinha, Trinity Soto, Jonathan Stanley, Timothy Stoner.
You may now don your white coats.
Meghana Devi Sankara, Marin Sword, Nina Talwar, Anna Rose Taylor, Sheku Taranka, Giovanni Torres Gomez, Charles Tran, Ryan Vascatellis, James Vedachira, Jashana Walia, Rachel Ward, Melissa Webb, Wesley Whitehurst, Rakik Wolde.
You may now don your white coats.
Anna Yang, Jake Yoon, William Zach,
You may now don your white coats. Chairs and department representatives, you may now be seated. Now I'd like to invite to the stage the designated family members who will present the white coats to their respective legacy students. Dr. Laura Campbell, member of the MD class of 1989, will coat her daughter. Dr. Nariman Dash, residency class of 2004, and Dr. Holly Raji, residency class of 2002, will coat their daughter. Dr. Sandeep Godambe, professor of pediatrics, will coat his daughter. Dr. Taryn Torre, member of the MD class of 1994, and Dr. Mayor Grobe, MD class of 1987, and residency class of 1994, will coat their daughter. Dr. Benjamin Holstedge, MD class of 2023, will coat his brother along with their father, Dr. Christopher Holstedge, Adjunct Associate Professor of Clinical Pediatrics. Dr. Dix Pappas, member of the MD class of 1988 and residency class of 1990, will coat his son. Dr. Pamela Pyle, MD, member of the MD class of 1984 and assistant professor in the Department of Obstetrics and Gynecology and Dr. Daniel Unger, member of the MD class of 1984 and assistant professor in the Department of Pathology and Anatomy, will coat their daughter. Now we will call forth the students. Logan Bay Campbell, Isabel Dashtizad, Maya Godambe, Gabriella Grobe, Samuel Hostage, Philip Pappas, and Faith Unger. You may now don your white coats. Would the MD class of 2027 please stand for the reading of the Hippocratic Oath? Students, you can find the oath printed on page 7 of your program. In addition to the students, we invite all other physicians here today to join in recitation of the oath. Upon this day of matriculation into the Eastern Virginia Medical School, as I seek admission to the medical profession, I do solemnly affirm, as did the ancient Greeks, by all that I hold most sacred, that, according to my ability and judgment, I will keep this oath and its stipulations. I will hold my teachers in this art equal to my own parents and extend to them the respect and gratitude which is their due. I will by precept, lecture, and every other mode of instruction impart a knowledge of the art to my progeny and those of my teachers and disciples bound by covenant and oath according to the law of medicine. I will follow that system of treatment which, according to my ability and judgment, I consider for the benefit of my patients and abstain from whatever is deleterious and mischievous. I will exercise my art solely for the cure of my patients and the prevention of disease, and will give no drugs and perform no operations for criminal purpose, nor far less suggest such a thing. With honor and dignity, I will practice my profession, not permitting consideration of religion, nationality, race, or social standing to intervene between duty and my patient. Into whatsoever houses I enter, I will go for the benefit of the sick, and will hold myself aloof from every voluntary act of wrongdoing or corruption. Whatever I may see or hear in the lives of others which ought not be spoken abroad, I will not divulge, reckoning that such should be kept secret. While I continue to keep this oath unviolated, may it be granted to me to enjoy life and the practice of the art, respected by all people in all times. But should I trespass and violate this oath, may the reverse be my lot. Thank you, and you all may now be seated. I'd like to just thank you all for attending today and enjoying this incredibly memorable celebration that we have. This is the conclusion of our ceremony.